So, good morning. I don't know, this usually you get started slowly, but in this forum, they've definitely picked the best to start things off. You know, nothing better than the really brand new, bright, innovative junior investigators we have here at our institutions. So I get the honor of introducing Alexander Lim, who's in the Radiology, Department of Radiology. We were chatting about his background very quickly. He trained at Caltech, where he trained in bioengineering, biochemistry, and molecular biophysics. He was telling me he loves being here in Boston as opposed to being in California because this is the hub for clinical application of the hard science that he trained to do. So I'm very pleased to introduce you, Alexander.
Well, thank you very much. I have the great honor of being the first speaker here today. And here I'm to talk to you about Brain Spec, which is a new technology we're developing to virtualize biopsies. This is born out of the iHub at Brigham Women's Hospital, Department of Radiology, and my lab at the Center for Clinical Spectroscopy. And really what the goal of this technology is to try to drive what is cutting-edge science into clinical practice by using a software service platform that allows us to get a virtual view of the brain by measuring brain chemistry. And we'll start first with a kind of clinical example. This is a case of a 4-year-old man who came into the clinic for an exam. He had, as you can see, that small little nodule on the radiological right-hand side, which is the left here. And you can see that it was obviously something that was a great concern to him. He was suffering from headaches and nausea. He went to 7 different neurosurgeons, and all of them said that they needed to biopsy it. And he was a lawyer, and so he knew that the risk of biopsy could lead to paralysis or possibly death in that region right above the brainstem. And so finally came and found a place that a surgeon to recommend to do MR spectroscopy. And it's obviously a term that's not a household word, but what it does is it looks at the brain chemistry in there and can tell us what's going on in that part of the brain. This technology has been around for about the past 10, 15 years, but really has been in the hands of physicists and chemists, and not really in the hands of clinicians. And recent developments that have really allowed us to look at this in more detail has been the advent of the identification of a genetic mutation, isocitrate dehydrogenase, or IDH mutation, that occurs in about 70 to 80% of brain tumors or gliomas that you can see here on this chart. And so it's a mutation that can be found either in the cytosol of the mitochondria, indicated by the IDH1 or IDH2 nomenclature. And the most important part about this genetic mutation is that it results in a specific pathway that gets affected within the cells. So you can see here, when you have the IDH mutation, it leads to the development of 2-hydroxyglutarate, the 2-HG indicated here in this graph. And the 2-HG is a chemical that can be very rarely detected using chemistry techniques. And this is really, I think, in the most recent years where this technology has become really applicable now to the clinic. So here, I'll present the brain spectrum of what one would see within the brain. So this would be the normal brain here on the left-hand side. And you can see that each of these different peaks represents a certain chemical. And in a brain tumor, we have a very, very different pattern here. And in particular, we have the identification of the 2-hydroxyglutarate here within the brain spectrum. And so, as it turns out in this particular case, his spectrum looked more like this. And so we realized that it was not a brain tumor, and he went on, and 6 months later, the lesion resolved itself and had no problems. This technique could be applied in other conditions, oncological problems, such as looking at pseudoprogression, where after treatment, it's often difficult to tell radiologically whether or not the tumor is progressing or not. And this technique, by allowing, again, this virtual biopsy to allow us to get the chemistry inside the brain and tell us a little bit more about what's going on inside there. This technique can also be applied across a broad range of other diseases, epilepsy, Parkinson's disease, traumatic brain injury. We have studies ongoing right now in our clinic looking at retired NFL players. And as one knows, heard a lot about the chronic traumatic encephalopathy and the diseases that surround brain injury. Alzheimer's disease, stroke, multiple sclerosis, and HIV are all diseases where measuring brain chemistry can make an impact. But the problem is, to analyze this data, it's actually fairly complicated. So I'm just going to give you a little run through example of what we typically do when we analyze a case. So we'll acquire the data on a typical MRI scanner, and then we'll load it up into this software here. Namely, it runs on Unix, something that is not very friendly to clinicians. And then you have to go through this step of loading up the software, setting up the parameters, checking what error message you have, and then you get the spectrum that you saw a little bit earlier before and get some quantitative data. And while this doesn't look too difficult, you can imagine in clinical workflow, this just doesn't work. And keep in mind that we actually acquire about 64 different spectra in a clinical case. So you multiply this process out by 64 times, and you can see why it hasn't been readily adopted into the clinic. And so our goal through a company called Spec is to make this a much more easy and more intuitive process. And so we've developed a prototype already where we have automated the data processing of the spectroscopy data so that instead of taking 2 to 3 days, which is really what it takes right now, our turnaround time in the lab for a clinical case is about 2 to 3 days, down to about 3 minutes. What we do is we automate the post-processing methods, and we utilize what is the cutting edge of science in terms of the software to do that. And it allows us to get quantitative and objective measures of brain chemistry. I think that's the most key point. The second point is this is a software that's developed by radiologists for radiologists. And so we've spent a lot of time working with them to develop an interface that is intuitive and easy for them to use. So for example, instead of visualizing the data as these squiggly lines, which is the spectra, which we recognize is not totally intuitive, we've developed interfaces that allow us to, for example, create a color map based on the chemistry of the different chemicals. So for example, here you can see in the brighter areas where the tumor is located, one can see a much more obvious way of visualizing this. And I think this has certainly ramifications in surgical practice where we can do a better job now perhaps of delineating where the lesion is, and so we can do a better job of cutting out the parts of the tumor that are critical based on the chemistry. And the idea of the software is to also make it absolutely quantitative and easy to integrate into the clinical workflow. So one can drag and drop these measurements and then copy and paste those into whatever dictation software is being used. And so we're currently at the stage now of integrating this software platform at Brigham Women's Hospital, as well as at Mass General Hospital, and to try to apply this across brain tumors as our first entry point. But we certainly see that, as I mentioned earlier, there are a number of other different diseases where it could benefit from it. We've now formed spun off a company just a few months ago. It's led by our CEO, Alexandra Zimmerman, who's a Tufts graduate and also Harvard Business School. She worked at Johnson & Johnson for about 5 years, developing devices there, and has a tremendous amount of experience with the FDA. I'm involved as a co-founder with my experience at Caltech and at Harvard here, and through our different grants and funds from the NIH and Department of Defense. But most importantly, I should also mention then we have also our physicist who's going to be my postdoc currently, but leaving and being the CTO of the company upon the completion of his postdoc in a couple months. He's trained from Oxford University. But I think more key to all of this has been the tremendous involvement we've had from Brigham Women's Hospital, from the Department of Radiology, from the Oncology Department. Over at MGH, we have people from Radiology that have been extremely helpful in helping us develop this software to the point where we really feel that this is going to be the way into the clinic for this incredible technology. And so in this last minute of conclusion, just want to emphasize how BrainSpec will make the virtual biopsy a reality by allowing us to have quantitative results that are objective and non-invasive. This technology is available across all MRI scanners today, and so it really is a shame that we can't take it and implement it and have it benefit patients across the country and across the world by making this software easier and more intuitive to use. So thank you for your time, and look forward to any questions in the seminar afterwards. Thank you.